So, Maria, if you want to walk us through, it would be very interesting to hear from you.
Hello, hi, and thank you for the invitation. I'm not sure how we'll share. I have prepared some slides, so I'm not sure how we'll share it. Is it okay if I share?
I think you can try to do that.
Okay, thank you.
Wonderful. We see your screen.
Perfect. So yeah, thanks for the introduction. At ENISA, I'm responsible for the activities in the health sector. So I will, today I'll go through briefly, so bear with me. I'll go briefly through the policy and regulatory framework for healthcare cybersecurity, the respective cybersecurity challenges in health, including threats and risks, and I'll also outline ENISA's activities in the sector. First, I'll go through the policy and regulatory framework. The main regulatory instrument is, of course, the ENISA directive, which was the first EU law to introduce the baselines of cybersecurity requirements, and it identifies sectors of essential services that rely on information communication technologies. So, of course, health is in the scope of the ENISA directive, and it includes entities that could be identified as essential and important. And what's new in ENISA 2 is that now the manufacturing sector is included, which includes medical devices and in vitro diagnostic medical devices. Another key piece of the policy and regulatory framework in the EU is the medical devices regulation. Overall, the MDR aims to ensure that medical devices are safe, are effective, and that patients are protected from harm. Next is the Cyber Resilience Act, the CRA, which defines the rules for placing on the market of products with digital elements, and of course to ensure the cybersecurity of these products. The final compromise text was published in late December last year, and it is expected to be adopted in the near future. So the proposal introduces cybersecurity requirements and incident notification requirements for products with digital elements used in the sector, other than the medical devices under the medical device regulation. Next up is, as mentioned, the Artificial Intelligence Act, that after 3 years of negotiation, the final compromise text was published last month with a view to agreement. And it includes several cybersecurity provisions, such as incident reporting and risk management, which means that many medical devices within the scope of the MDR will qualify as high-risk AI systems. And the last policy document, which is also in proposal stage, is the EU Health Data Space. The EHDS aims to create a secure cross-border exchange of health data in Europe. It also includes cybersecurity requirements, specifically for healthcare record systems. So the CRA will cover digital products. The HDS will introduce requirements for healthcare record systems, and hopefully will address the gaps in NIS and MDR. Moving on to the cybersecurity threats and challenges in health. Over the years, at ENISA, we've collected information from many sources, and we've identified the key cybersecurity challenges relating to the sector. First, we've seen that there's a global increase in sophisticated, targeted, and coordinated ransomware attacks in healthcare organizations in general, which remain highly active. And it's estimated, I will go through more details for threats later, but it's estimated that the sector will continue to be heavily targeted by ransomware groups. There's also been a global rising trend in health-related data breaches. Supply chain attacks are also increasing, and they're introducing the potential propagation of infection and especially ransomware. We've identified that there's low cybersecurity maturity in the sector and lack of security awareness in healthcare organizations. It's been reported that healthcare organizations use many legacy systems as well, which means that they either lack security patches or updates, or equipment is outdated. And finally, it's been noted that there's a shortage in cybersecurity skills in the sector and the resources in general. So this results in insufficient cyber threat and risk management. Now, as per the incidents reported by the member states through ENISA's Cybersecurity Incident Reporting and Analysis System, CIRAS, you can see that the most impacted sector for 2022 was health. So 32% of the incidents reported in 2022 related to health. The sector is in the lead for 3 years in a row. And second comes energy, then banking and transport. The nature of these reported incidents mainly related to system failures and malicious actions, which was also the trend in the past 3 years. And the underlying technical causes for these incidents mainly involved faulty software changes and updates and hardware failures, which was also a trend in the past 3 years. Now, from last year, ENISA publishes sectorial threat landscapes, so we also publish a threat landscape for health. The collected incident-related data were from publicly available resources and spanned from January 2021 to March 2023. And then identified threats mainly related to malicious actions. So the analysis also deep dives into the impact to the sector, and I'll go into a bit more detail because I believe it's of interest to everyone. So here in the first graph, you can see the types of threats identified during the reported period, which is mainly ransomware and data-related threats. I should note that one incident might be classified into more than one categories, and this is why maybe the total percentages might not add up to 100%. Also, the second graph shows a breakdown of the types of health organizations that were targeted during the period. As you can see, healthcare providers and especially hospitals were the most affected by the threats. These two graphs now show the categories of cybersecurity threat actors and the motivations considered for the analysis of the incidents. So, as you can see, during the period, the threat actors mainly related to cyber criminals that were motivated by financial gain. And now these graphs show the impact of the said incidents. In terms of assets, in the first graph, patient data and electronic health records were targeted the most, as well as non-medical IT systems and networks. And as for the consequences, it seems that breach or theft of data is the most common, followed by disruption of services that are not related to healthcare. Also here, one incident might result in multiple consequences, so the percentages might not add up. And finally, as for the entities that data breaches have affected, primarily hospitals were affected, followed by pharmaceutical entities and health authorities, bodies and agencies. I'll move on to ENISA's contribution in healthcare cybersecurity. We've been working in the sector for a number of years, so I have a lot to say. First, we report annually on NIS investments by the entities. So the report issued in 2022 included a health deep dive, which means that more health entities were surveyed and additional sector-specific questions were asked, such as on medical devices, cloud, and cybersecurity awareness. On medical device security, the survey data indicated that 64% of the entities in health were using connected medical devices in their operations, which is expected. And 38% of health entities do not have any specific security solution deployed for connected medical devices. When the entities were asked whether they have a dedicated ransomware defense program, which means dedicated resources and budget, they responded, 44% of the responses indicated that they do not have a dedicated ransomware defense program. And with regards to awareness raising or training programs for non-IT staff, the entities' responses indicated that 33% of them have no awareness program at all in place for non-IT staff. And finally, as per the surveyed organizations in 2022, health is the fourth sector with the highest average direct cost for major cybersecurity incidents, which is at 423,000 euro, right after banking, energy, and transport sectors. Another interesting publication by ENISA is the one on engineering personal data sharing. This one includes use cases relating to personal data sharing, primarily in the health sector, and how specific technologies and implementations can support data protection, as well as the challenges in personal data sharing, of course, and how to engineer specific technologies and techniques in order to enable privacy-preserving data sharing, let's say. In addition to these reports, we've published a number of reports over the years, such as the Cybersecurity and Resilience for Smart Hospitals, the one on procurement guidelines for cybersecurity in hospitals, and one on cloud security for healthcare services. All the reports that I've mentioned are available on ENISA's website. Also, in order to bring the healthcare community together, we organized the annual Health Security Conference. The one last year was held in Luxembourg and focused on the aspects related to the implementation of NIS2 for health and other e-health policy developments. This year, the event will most likely be hosted in Budapest in late September, early October, and details will be published on ENISA's website. Moreover, ENISA is a board member of the EU Health ISAC, which exists for a few years and is gaining momentum. The EU Health ISAC is chaired by and driven by ZICERT in the Netherlands, Membership is free of charge. However, travel and accommodation expenses are at members' cost. Currently, we have healthcare providers and CSERTs as members of the ISAC. And in case you are eligible or you know someone who is, I've included the contact details for the ISAC secretary, so you can reach out to them. Now, another important initiative is, of course, Cyber Europe, which is the pan-European cyber crisis exercise organized by ENISA. The exercise that took place in 2022 focused on the health sector and aimed to test the resilience of healthcare services in Europe. Unfortunately, the attacks that impacted the sector during the previous years supported our choice of sector. And the scenario included real-life technical incidents, real-life inspired technical incidents that built up into a major crisis. And as per the after-action report, the findings confirmed more or less what we had already known. For example, that smaller entities struggle when it comes to cybersecurity. The need for frequent testing at local level was confirmed. The importance of sufficient budget and resource allocation was also confirmed. The criticality of awareness raising for cybersecurity threats and risks was also confirmed, especially for non-technical staff, for medical staff. And of course, the exercise provided an opportunity for the participants to prepare for a real emergency. Now, together with Cyber Europe, back in 2022, we launched an awareness raising campaign targeting the sector, which is part of a 3-year plan up to 2024. And the material includes videos, illustrations, infographics, and the content is uploaded on ENISA's website and translated into, I think, 5 languages to date. So the material could be used in your organizations, but you could also disseminate it further if you think it will be useful. And finally, we also developed a framework for building an awareness culture, the AI in a box. This framework includes the steps to prepare a custom awareness raising program. The material is sector agnostic, so it includes templates for media campaigns, infographics, posters, tabletop games, quizzes, and it's very useful in order for an organization to design an awareness program. So these were all ENISA's activities in the health sector. And in order to conclude, what I'd like for all of us to remember is that cybersecurity landscape is highly influenced by the unstable geopolitics, disinformation, and sophistication. And of course, the sector is critical, so it must be protected from cyber attacks. There is a need to increase investments in cybersecurity in order to ensure resilience of critical infrastructure across the EU. Awareness at board level will improve the maturity of cybersecurity in the sector and will drive the relevant investments. And of course, staff awareness and training is key, especially for medical and clinical staff. Also, it seems that the coexistence of several cybersecurity regulatory developments at the EU level requires cooperation and support by both the member states and the private sector. So now the new regulations are setting the framework, and that's why I wanted to briefly go through them at the beginning. And finally, information sharing and increased cooperation between the stakeholders in the sector is crucial. So thank you. That's all I had to share. Thank you very much. I'm not sure if we'll take any questions later, but I'd be happy to respond to any questions.